Here's to Your Health, where we talk about the important things that get your health in line. And we're so in tune in this day and age in preventative medicine, keeping you out of the emergency room and keeping you off the operating table, and that if you can do something to make your body even better. This is Steve O'Brien. Thank you so much for joining me. Denny Lindemann is here with Kraft Body Scan. You've heard me talk about it on the air. Denny was the first guy actually with the company that I ever met, and it's great to have you here.
Hey, thanks for having me down on the show.
So let's talk a little bit about, people, I'm sure, have a little bit of maybe think that you walk in, you get a scan, you walk out, and that's it, but boom, 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 and that's not the case. When people go to Kraft Body Scan, one of the important things is they're going to sit down with you or someone in the building to get a complete explanation, not only what's going to happen, but what everything, talk about your health, and that's an important thing.
No, absolutely. One of the common things that I think just everybody has is a little bit of fear of finding something. And so there's a process, and the process is to get scanned. It only takes about 5 minutes. It doesn't hurt. There's no needles. You don't have to get undressed. You don't have to prep for it. Literally 5 minutes, you lay on the machine, and it takes detailed pictures of either your chest or your abdomen or pelvis, whatever area you're looking at. But it's what happens after the scan that's most important. You get this radiology report, but there has to be somebody there to sit down with you and explain, what is this thing that was found? Or, is this calcium score good or bad? And that's something we do to try to help people once they get that report, figure out whether they need to do more than just take pictures.
It's important, too, to understand exactly what kind of a history someone has. Do you take any medicines? What kind of things have you even talked about with your healthcare provider or whoever it might be? Because that's so important to be able to focus where you want what you want that scan to look for.
Absolutely. People come in and say, I want my pancreas scanned, or I'd like to have my colon scanned. The idea is the machine can take pictures in strips, and whatever part that somebody's fearful about, we can take pictures of that part, or we can take pictures of the whole thing. But the whole idea is we use it for a preventive. We're not waiting until somebody's sick or they have pain and go, gosh, I need to go to the doctor. They're going, you know what? I care about my health. I'm going to do something good for my body, and I'm going to go in and I'm going to get the scan way upstream long before I ever feel anything, because if I have a tumor in my lungs, or if I have a tumor anywhere in my body, you can't feel it at stage 1. It's not until about stage 3 or 4 that we start to notice something's wrong. And that's the whole idea behind getting that preventive scan.
Plus, there's so many people that are at high risk. We've talked about different age groups. We've talked about ethnicities. We've talked about what your family history was. Someone goes in and says, I feel fine, everything's great. Except for the fact, my father had a heart attack when he was about my age, or my mother had cancer in her lungs, that sort of thing. It's important to get that information out.
Well, it's a double-edged sword. Just about everybody out there that's listening to this message, if somebody in your family has had cancer or heart disease or an aneurysm, well, yeah, that might increase your overall, relative risk, but it's the other people that we really want to reach as well. That person that's talking to themselves going, gosh, you know what, I run every day, I eat my vegetables, I'm not overweight, I'm probably not at risk, and that's not true. The whole idea of preventive scanning is it doesn't matter how big you are, how small you are, how old you are, how young you are. The idea is get in at about age 40 and start getting screened, and get screened regularly, because if you're going to find something early, you need to find it before you feel it. And it doesn't matter how good your body is or your family history.
So let's talk about the actual scan itself. People hear scan and immediately think of a big, huge machine and that sort of thing, and extremely high cost. And the cost here is not extremely high. As a matter of fact, it's very affordable and reasonable. Tell folks the difference between the scan that you're doing at Kraft Body Scan and maybe a scan that they got in the hospital or somewhere along that line?
That's a great question. I get asked that all the time. And the machine is pretty much the same. A CT machine is a CT machine. The difference is protocol. We do something called LDCT, which means low dose CT scan. So our machine has been configured to take the best possible detailed pictures we can with the least amount of radiation possible in order to get good pictures. Now, if we find something, let's say somebody has a tumor and it's fairly large. That happens several times a week at our clinic. Somebody with no symptoms, they go, hey, this is a good idea, and we find something on the liver or the kidneys. Well, that person's going to take that report to their general doctor and get probably a referral to go to the hospital, and they're going to repeat the scan, but the second time around, they're probably going to take a little bit of contrast and put it in the blood and try to get detailed pictures of how that tumor is reacting with the other organs around it and whether or not it needs to be surgically removed. So our process is, let's find that you have a problem, and if you have a problem, then let's go and do some further test or possibly surgery to remove that tumor before it has a chance to affect the body or move around the body where it becomes very difficult to treat.
And the important thing is, as you mentioned, the scan, and I've said it on the air several times, it takes 5 minutes. It's a quick thing. It doesn't hurt. It's very non-invasive. But after the scan is done, I think is one of the most important parts, because the scan then goes to a board-certified radiologist.
Absolutely. I mean, our company is full of doctors, radiologists, and great people. The founder of our company founded this company with the idea of helping people. And so we have very qualified doctors and radiologists that look at those images and they write the report. And then when we send the report, we have somebody available to go after over it after you have the scan. So it's a complete checkup of the body, kind of like a virtual physical. So many people go get their regular physical, they get blood work, they get urine work, and they have a discussion with their doctor. Visiting your doctor yearly is one of the best things you can do for your health, but your doctor doesn't have x-ray vision. You cannot see a stage 1 tumor inside your lungs. And so the whole idea behind this is insurance doesn't pay for really any preventive scan. They'll pay for your colonoscopy, they pay for your physicals, and if you're a woman, they'll pay for your mammogram, but that's really pretty much it when it comes to what you can get out of your insurance for preventive reasons.
Preventative health care is so important. Let's talk about something that's going on right now. I want to talk about heart and lungs later on. We've got plenty of time to talk about it today. Colon Cancer Awareness Month is going on right now. How much can Kraft Body Scan do for you with a virtual colonoscopy? First of all, explain that.
Okay, yeah, it is Colon Cancer Awareness Month, and I guarantee you that there's thousands of people listening to this right now going, you know what, I need to get in and get my colonoscopy. And if you're over the age of 45, heed my words, get in and get your colonoscopy. It's colon cancer is the second leading cause of cancer-related deaths in North America, and it's entirely because of our food and diet and lack of exercise and a lot of other factors. But a traditional colonoscopy is paid for by insurance, typically around 45. And the process is, a small video scope, and they do use anesthesia, so they knock you out so you don't feel anything. And they go in there and they look for polyps that would eventually become cancer, and if need be, they remove them. And so, but what we do at Kraft is a little different. A lot of people have avoided getting their colonoscopy simply because they're scared of it. The idea of being knocked out by anesthesia.
No, wait. I want to tell you the reason people put it off, and you know darn well what it is. No one likes to drink that stuff the day before and all that. You know that.
Well, absolutely. But, even with the virtual colonoscopy, there's some prep. Now, the prep for a virtual is slightly easier, but, the process, you got to clean it out. I mean, the CT machine cannot differentiate a piece of broccoli from a tumor in your colon. So really what it is, spending a couple days eating foods that are light in fiber, not eating meat, stuff that's going to digest quickly. And then, of course, the day and a half before, you do have to drink some stuff that causes diarrhea to clean the system out. But the idea is we want to have a clean colon when we take images, because if you have a very small polyp, it may or may not need to be removed, and we want to get a good image of it.
And the one thing you brought up that we've been talking about on the air is the fact that after this is done, you get up and you walk out, and there's no one has to drive you home or anything like that. It's a much easier way particularly if you have any kind of a history of not just colon cancer, but any kind of cancer in your family.
The big difference between the traditional and the virtual really comes to the process. Both of them are very important. Both of them can identify tumors very, very early. The virtual does not require any anesthesia. So people that don't want to be knocked out, that's a big deal. Secondly, there's no probe in the body, which means that it's virtually impossible to perforate the colon. And it's a very small number of people that get a colonoscopy that get perforated. But when you have a 5-foot probe inside the body, sometimes accidents happen and they punch through it. So with the virtual, no anesthesia, no probe in the body. It takes about 20 minutes. You can drive yourself down there, drive yourself back, and it's much easier to prep for.
And so with the is there anyone in particular risk that maybe this isn't for them, that they really need to get an actual colonoscopy, or can this be used on anyone?
Well, there are pros and cons to both. The idea of the virtual is, yes, it's less risk involved. However, if there was a suspicious polyp found, that person would have to go back and do a traditional colonoscopy to have it removed.
Sure.
So prepping for it twice or having to do it twice certainly isn't fun. But the positives are it's almost impossible to be perforated or have tearing or ripping or scratching in the inside of the colon, and there's no anesthesia. Sometimes people have an adverse reaction to anesthesia. So, for people that are relatively low risk of colon cancer, the virtual is typically the way to go. People that have a history of colon cancer in their family, or have had many polyps found in their first or maybe their second colonoscopy, a lot of times a doctor would recommend just sticking to the traditional because it's probably going to find more polyps and don't have to prep for it twice, right? So
I think it makes perfect sense, and it's so, like you said, so much easier. Nothing internal. Yes, there's some prep involved, but that's to make sure that the scan can see exactly what you want to see over the course of the exam, and it is so easy.
Just do it. If you're listening to this message, either do the traditional or come down to Kraft Body Scan and do the virtual, but just do it. There's so many people out there. One of the things I hear often is this Cologuard, right? And so a lot of physicians now are offering this to their patients, which basically takes a stool sample and looks for blood and other things in the stool. But I think sometimes that gives a false sense of security. Obviously, if you have blood in your stool or something that's found in Cologuard, that's probably not stage 1. It's probably a little bit more, defined or a little bit more along than you want it to be. When you want to catch cancer at stage 1, not stage 3 or 4. So I just implore, if you're listening to this message, get out there. If you're over 45, talk to your doctor and just get in and get your colonoscopy. It could be the smartest thing you've ever done for your
We're going to talk more about it in just a second. I am Steve O'Brien. Denny Lindemann is with Kraft Body Scan, and we're so happy to have you here to talk about this stuff because it's important. We're going to talk about that. We mentioned about heart and lungs. I want to talk about that when we return on Here's to Your Health.